Thanks for staying with us. We have a call from the UK. Good morning. Are you there?
Yeah, I'm there. Good morning.
You're live. Go ahead, please.
Yeah, I just want to quickly contribute to what you guys are saying about the doctors in Nigeria. You see, I think the main problem is about Nigerian government. Let me give you a scenario. A doctor here in UK, which I'm very close to, actually, he has a GP, and he actually come to a conclusion that he wants to relocate back to Nigeria to start up a hospital business there. But do you know what happened? He sold his GP here in UK. He sold it and took all that money. And with all the other savings he had, and went back to Nigeria to start up a business, hospital business there. My sister, today as I'm talking to you now, less than 2 years, that same doctor that has his own GP here in UK with staff and everything, he came back NCR with black bag, not a traveling bag, with black bag. He came back with nothing. He ended up losing all that money back home in Nigeria. He was frustrated. Fine, when he got to Nigeria, he got the building, everything. He got some loan from bank and everything. But at the end of the day, that guy was frustrated, and he came back here empty-handed. The most painful part of it is that the GP that he sold here, that it was the owner of that GP, he now had to go back there to get an employment as a worker there. So that is a lot of people want to come back to Nigeria, like what Esther said.
All right. Thank you, Christopher. You see, as I said, we've dwelled quite a bit on the problem. Let us start looking at solutions. Let me talk to Dr. Osikoya. Dr. Osikoya, you've heard everything everybody is saying. Do you see any possible solutions in sight? What do you think we can begin to do? I mean, I talked earlier about having that group of Nigerian doctors coming together abroad to support those of you in Nigeria. Or what else can we do to support or to ensure that we get proper health care? What do you think? What would you suggest, Dr. Osikoya?
Yeah, thank you very much. The first thing, everything in Nigeria is out of pocket. People who come to your hospital, they pay out of pocket, assuming there is NHIS covering for everything. That's why we said that there is a policy from the government parties, zero. There's no sincerity. Because when somebody came all the way from abroad, wants to come and set up a business, hospital business here, you use bureaucracy bottleneck to hinder them. Now, for example, I came into hospital, I'm just analog now. I built a very big or giant hospital, and people will come and pay out of the pocket, and they'll beg you, doctor, I don't have this. Are you going to recoup all your money that you used to buy equipment to purchase this and that? No. But eventually, if there is NHIS system that is working perfectly in this country, at least maybe most hospitals, most private people that are coming to establish in this place will be able to try better. But we are not having that. Everything in this country is from out of pocket. And how many people can afford to go to private institution? Now, when you are not talking to, people go to government. Even at that government is starving their staff, their workers. Not paying them regularly, not giving them their allowance regularly. Right. So people will not go. Do you know how many people that have come to government hospital and they are unable to pay? But one of the ways you can solve the problem is by introducing NHIS.
Okay.
Let that be coverage for everybody.
Right. That's critical. Thank you very much. That's another very important point. Insurance, where everybody knows that you have access to healthcare as long as you have the NHIS. But we must be fair, because I have been in the health circles in recent times, as I told you, and we do have some equipment. It's just that it's not enough. But because I know that, for example, for cancer, for example, and I know there's a partnership in Louth. There's a private-public partnership where they have an established hospital within Louth. I also know that in OAU, they have they focus a bit, I think, on more of I can't remember what the focus is on. But the point is that radiology, urology, and all that. The point is that the government is making efforts somewhat. it's not enough, or there's comparison to the population we're dealing with. So we need some quick fixes. And those quick fixes, there's the big teaching hospitals can have certain equipment, but it's the quick fixes that we're looking for. And NHIS is definitely one of it.
Is one. But the very first one is the medical workers themselves, I'm not talking doctors alone, to stop the psychophancy. When they need to go investigate a hospital, you then bring out the things that you don't have. You don't show them the real picture. Government officials will live there and say, we visited the hospital. They have machines. They have everything. Everything is working. For Kogi State, for instance, that they have that one machine. Can somebody show them the real picture of if there's a queue of 23 people or 100 people, how fast that machine, what will happen if those 100 people cannot access the machine within the number of days? It's not about just having one. Or even folding it and covering it up until government officials wants to.
Damilare has been holding a lot. Let me get Damilare's call. Good morning, are you there?
Good morning.
You're live. Go ahead, please.
Okay, thank you, ladies.
Yes.
I've been listening keenly with the conversation. But let me quickly add that when we are talking about brain drain, it is multifaceted. It is not only health sector now. It is all areas of the country. But it is more pronounced with the health sector. And not only the medical doctors now. Even the lab scientists, the nurses, they are moving in large numbers. We need to look into that. If we should be taking statistics, we will see that other professional teams are leaving this country every day. And to talk about the problem and the solution, it is so unfortunate that our government is insincere. If they are sincere, they know what to do. They know this problem. You can imagine a government institution whereby you refer a patient from a federal government institution to a private institution. So what are we now talking? Is that how things are supposed to be? And
Thank you, Damilare. I have to go on a quick break. When we come back, we'll take more calls and read more messages. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. So we're going to take messages at Nima. Let's take all from YouTube. Yeah.
Oyedele says, in America, if a state trains you by subsidizing your education, you must stay in that state and pay taxes for at least 10 years before you can leave. Joke Balogu says, our leaders' children studied abroad and are working abroad. Have you put any system in place to stop our leaders traveling abroad for medical care? Ola Didi says, do government subsidize doctors trained in private universities? I don't get it. They're insisting that it's more expensive in Nigeria still.
Daisy O says, government needs to be humble and provide for their citizens and leave this thing of pride and big spending lifestyle. Government, please treat your citizens right. Kelly Ola says, if you can create a good environment and even pay doctors peanuts regularly, and doctors won't leave the country. It's not about the money, but the money is also important. Ebezilat says, Nigerian government is bad, but many will japa and come back, chop government position temporary as side hustle, while their families still stay abroad. When they finish the Nigerian government side hustle appointment, then they go back.
Let me come to our guest. He's still on. Dr. Osikoya, so you told us earlier that NHIS is one option to keep doctors. What about partnership with other doctors abroad? As I said, many Nigerians who moved on in the 90s and 80s have built hospitals here. Some of them are still moving home till today. And they're working in Luther, working in teaching hospitals as consultants. So are there any plans for resident doctors to begin to have some kind of partnerships abroad such that you can have the support you require from private people?
Yeah, when you are comparing 80s to 2020, which year we had 21, the difference is far. Then in the 80s, how much is Naira to dollars then? How is the situation on the ground then in the 80s? Now, look at now. There is insincerity on the part of government currently, presently now. You want people to come and partner with you in Nigeria where there is a lot of bureaucracy bottleneck, or where you build an hospital and you end up doing like a charity to the people because they are unable to pay the fee. Government is not even ready to subsidize anything. So the partnership might not work. It might not work.
Interesting.
So how do you expect it to work?
Let me take this call from Abuja. Good morning, are you there?
Morning, I'm here.
Yes, go ahead, please.
My view is that Nigeria, this thing called brain is what the government is doing. The government needs to make things work. Have a good environment. Most doctors are not employed in Nigeria. We have doctors that are doing local. Do you know what they earn by doing local? Doctors that are abroad are earning times 10 of what we in Nigerians are earning. For you to even get a job as a doctor is a problem. I worked in Abuja before leaving for my residency training. I couldn't get a placement for residency training in Abuja. My family is in Abuja. I have to spend almost 100,000 naira every month on transportation just to see them 1 weekend a month. Just this for being a doctor. Nigeria didn't train me. I trained abroad. Nigeria didn't train me. So why would you now tell me what has Nigeria done for me that you want me to stay in this country and be drained? I couldn't get a job in Abuja. I have to go for residency. Now going for residency, if they don't receive me, anything for 1 weekend in a month to see my family, that is that month I'm not going to see my family. And I still have to spend, I have to fly, I have to transport myself to where I will take to Abuja. Then come to Abuja just to see my family once a month. Passing part 1, I went to the hospitals in Nigeria, in Abuja, to get a placement for register. They said they don't need senior registrars. That means they don't need doctors. And you don't want these doctors to leave the country. Are you going to be feeding them? Do you know what school fees cost in Nigeria? To go to a good school, a standard primary school in Abuja, you have to spend about 500,000 naira. And how much are we earning? If we now have a doctors, both of them.
All right, so thank you, Hafsat, for taking us there, because we're talking about ripple effect, but there's a word that our guest has been using, insincerity of government, which I get. But isn't there also an insincerity in the part of Nigerians? Because we're saying the doctors are paid high abroad. It's not as if the money is falling from heaven. They are taxing their people. These doctors who have been studying are paying back. So if you that had graduated and become a doctor, you don't pay back. The government may not have money to pay those and give them student loans that are coming behind you. So it is that ripple effect, that sincerity on all parts. So the doctors that are being paid abroad are they are being paid from the money from taxes and the student loans that are being paid back. What are we doing here? So we want the government to pay your doctors. Where would they get the money from? That's the question.
Can we talk about the grass suffering right now? Because, when two elephants are fighting, it's the grass that is suffering. So in between the doctors on strike and the government going to get cut injunction, get back to work, we are doing this. We have people dying on a daily basis. Patients dying on the people that cannot access healthcare, cannot afford to get healthcare in private hospitals. People that consultants cannot see to them who are dying. Who is worried about such people? Who is speaking for them? Because I feel very, very bad when you create a chronology of the numbers of strikes that has happened under our current minister, Dr. Chris Ngige, across multiple sectors. It is worrisome. And I'm wondering, what does the president use to measure his performance? Because, what's the KPI for Dr. Chris Ngige? How do you measure his performance if there's so much strike back-to-back going on across and bickering across many sectors? So even if I'm not dealing with the Minister for Health.
Well.
Yes,
so
Minister for Health as well.
One of the solutions would be to put our priorities in order. We cannot give hazard allowance of 5,000 naira in a pandemic.
Who does that?
Doctors. Please, I will give wardrobe allowance that we will not fail to pay, or give sitting allowance that is extremely disproportionate to the kind of work they do. We cannot. We should arrange it on other priorities. Which one is extremely important to us before we have our soldiers brain drain?
Yes, so.
It's possible.
They are prepping already. I've already started hearing.
We're not even appreciating our soldiers enough. And we're not even investigating the level of corruption within the army.
Okay, so, as a moderator, I have to also look at all sides of this, of the coin. So I hear that we are not paying appropriately as we should. But this is the same people that, if they want to increase taxes, we scream. The America that we all run to, they pay through their nose. No. The America that we see, they pay through their nose on taxes across board. But here, they ask you for taxes to pay, and we all call. What's that name again? NLC will come out and say, no, we cannot pay. Ordinary NLMG.
I bought Gary on Sunday, just yesterday, 1,500 naira for a paint bucket of Gary Jebu. I bought it just 2 years ago for 700, 800 naira for a paint bucket. Is it the same salary that has not been increased that you are tasking? If you tax me and the tax is to build me hospitals that I can access.
But
now I have to go and do health insurance, the most affordable one for my family by myself. Please now, if you're tasking me, let me see what the tax is going into. Let there be the facility available.
What of the part of it? What of the part of where that we have a huge bracket of Nigerians who are not paying taxes? At least we are working. So there's a huge money that we're losing. So imagine,
even in Lagos,
like I think it's about
10%.
So if we have that figure, one second, I'll come to you. Imagine 50% of these 200 million Nigerians who are working are paying taxes. Where will they? Then you pay your doctors properly. Then you'll be able to improve.
Whose job is it to capture the people who are not paying taxes? Is it my job? Is it my job? Everybody should do their job. That's where the problem is. And the comparison now of you see the lawmakers, you see the executives who did not even spend this amount of a number of years in school to get this qualification are the ones earning more, and you who have spent sleepless nights, number of years, pay through your nose to go through school to save lives. So it's not like you're working for your pocket. You want to save the lives of people. You're not earning anything close. That is where the comparison is.
Let me quickly just answer on the tax that the big people so-called that we think are captured are the ones who escape taxes the most.
Who are owing us?
Who are the business owners getting waivers?
Buying champagne.
Please now.
Let me take out, Dr. Osikoya there with you. I want you to hear the back and forth so you know how to respond to the ladies' thoughts on this. So what do you make of what we're saying right now?
I can hear you. People are talking of taxes to pay doctors and everything. If I hear you correctly. But let me give you another scenario. I know of some state government that are paying half salary to their doctors, and they are removing full taxes across board from all health workers. You are paying half salary compared to other states, and you are still removing full tax from them. What's going to happen to those doctors? And because of that, they are paying half salary, and they are still owing between 6 to 10 months of salary. And you are collecting your full tax from the half salary you are paying because you thought there is no money in circulation. And if all those doctors in that particular state decide to go to Saudi Arabia or UK, say they are not patriotic enough, or they are not taking. So you can look at it from that angle. Government is not being sincere. Look at all our hospital where you're supposed to see 600 doctors to be working, you only see 50 working. And you're not paying them half salary. At the same time, remove full tax. There's nothing stopping government to encourage doctors that, okay, I'm going to exempt you from paying taxes over so time because I'm paying half salary. But they are not doing that. They remove full tax from their half salary they're paying them. And at the same time, I want the doctors to be working. And those doctors who go to the market, are they going to go and tell the woman selling rice, okay, give me rice, government is yet to pay me, I'll pay you when they pay me my money, or I go to filling station, or to say, okay, you pay me later, I'll come and pay back later. It's wrong. That's injustice, that victimization.
Let me take a caller. Good morning, are you there? Hello?
Yeah.
You're live. Go ahead, please.
Okay, the problem, we are looking for a solution in this country. We don't have the money. The budget is very small. America is 320 million people. Their budget is $1.3 trillion. Multiply it by 500. That is about 700 trillion naira. And Nigeria, we are 200 million people with a budget of 13 trillion. Where do you think what we can do with that? We cannot solve our problem until we increase our budget. We're supposed to be operating at a level of about 50 trillion naira for Nigerians to see the impact. With 13 trillion, that is about $26 billion. It's not going to solve our problem. So that is the issue, and no other thing. So we have to look inwards and find a way to generate money so that our budget can be increased to up to 50 to 100 trillion. That's the only way we can
Let me stay on wheel for Dolphus. So you're saying that we need more budget, but we're also saying that a huge part of Nigerians are not paying taxes because everywhere around the world, people get money from taxes. So all of us who are working, I think I don't have the figures right now. There's a huge bracket of Nigerians who are working both formally and informal that are not paying taxes. So where is government going to get the money from?
Capture them.
So we're asking everybody to do BVN, it is Wahala. Money. Do NIM, it is Wahala. So the idea is that how do we capture Nigerians and ensure that they pay taxes? We want to do what they're saying in this country.
Almost 70% successful already. So what are they doing with the data?
Go ahead, engineer. Go ahead, Dolphus, I can hear you. Okay, I think we lost that. Yes, Nima, I say something.
I said the NIN is almost 70% successful based on all the indices that the Minister for Communication has been talking about. So what exactly are they doing with the data that they have? What are they projecting? Okay, now we've captured everybody, but then we are still giving waiver and tax moratorium to some businesses or some big men that are politically connected. We are not serious. The people that are making the monies that we are seeing like this, they are being waived.
That the tax will be when it enters
there's
the
a projection of based on somebody's private business in this country that they have been using to plan for the past 4 years. One person's private business, they have been using it to plan since. The person is enjoying all the tax waivers. And they are just planning, 4 years ago, it has not come to fruition.
So I think Adolfo has really hit the nail on the head. We need money. No matter how much you look at it, the budget of our country has to increase. And we need to first of all start from top end. It's easy to tax those on the ground bottom, but those rich folks who are making the money, those billionaires, those who are bringing in champagne, as much as you think that champagne is insignificant, trust me, it's huge. And they're bringing in taxes.
And the honesty in how we are appropriating the funds. So the doctors will complain about the hypocrisy because they see that even when the funds land, what are we prioritizing? So there must be honesty and transparency in how we prioritize our expenditure. Because that is when people will be willing to take that 100,000 naira salary. Because we can see that even our president has cut. He's no longer traveling abroad. As long as they have him.
Okay, we have to wrap up very soon. So I'd like to thank Dr. Osikoya for joining us. Any final words on this? Because we're running out of time, Dr. Osikoya, before we run off.
Well, I believe this is the best. I'm happy with the program we are doing. In fact, it's the best time for the masses and for the people of Nigeria to speak out so that government should be sincere for once. So that they can change the whole narration in the health sector and they can put a stop to this brain drain for once and for all. Not the usual of this putting everything in paper, making promises here and there that they won't know to themselves that they can't fulfill. It's better for us to know that, okay, we take care of this health sector and everyone know what we are doing. Or they can just privatize all the government's hospital in Nigeria and let us know that it's private totally and government is not handling the health sector. If that's what they have to do, they need to show us the policy so that we know what we are doing. Sincerity is the word there. Thank you very much.
Thank you very much, Dr. Osikoya. It was a pleasure having you on the show this morning. Let me take our final caller from Austria, I believe. I think I lost that call. Hello, are you there? Okay, we lost the call. Let's take final comments before we wrap up.
Bimbo Thomas says, I've always said it, any doctor that is working in Nigeria with the way things are is only being patriotic. Opportunities abound outside, and I'm glad they are leaving to seek those opportunities. Ashiru says, Murayo, even pure water sellers are paying taxes in Oshodi market. Well, it's not remitted.
It's not remitted.
Adesuwa says, if the government insists, they should reduce their own salaries instead of piling taxes on poor Nigerians without them getting the benefit.
Look, I want you to pause there. You see, we always, that's what Nigerians usually, the first thing, let them reduce their own salary. Even if they reduce it, they let all our leaders today start earning 18,000 naira. Is it going to build your hospital?
Let them start first, then we'll take it.
Is it going to build your hospital? Is it going to pay all the doctors? So the point, I'm not saying
if they earn 18,000 naira that they did not collect back with their left hand.
The important point, because the easiest thing for Nigerians to do is to point a finger, wait, it's them. They're earning so much money. But we also have a role to play. Many businessmen today are running business and not paying taxes to the federal government.
So let us all
put all the chips on the table.
It's not the child that will tell the father, this is how we run this home. It's the father that will tell the child, this is how we run this home. What we are lacking is a vision. What is the plan for our health system?
The father will not go and call his uncle, NLC, was in Labour Congress. Now come up, carry placard and shut down the whole of the government saying that because
to be sincere that this is the plan we have. This is our failing system. This is how we are all going to tighten our belts. Right now, all of us who are not traveling, we are going to use our facilities in Nigeria. First of all, that will cut costs. Because that facilities they are traveling about to use, is it not our money they are using? It's the taxpayers' money.
It has not even paid you. It is our monies that were stolen by us and deposited in some banks that developed the economies of those countries where we went to deposit them abroad. And after they have finished using the money have devalued. They have returned the shafts.
Okay, I think I have a final call. I have to wrap up. Do I have a caller? Good morning, are you there?
May we wake up?
Can I slice in one? Hello? Oh, I think... Hello? You're live. Go ahead, please. Oh, sugar. We lost that call.
Can they please just increase the hazard allowance, though? At least in the minimum. Let's just...
Don't forget
that's all we
said.
can take on the show.
Please, Nigerian doctors, use the ones that are in your care to treat people. Yeah. Why will you send somebody outside to dialysis to a private... Please, let's not be wicked before we call government.
Anyway, my own final comment is that, listen, government, we've lost that trust in government a lot of time, but whatever we can do as a private, your own part is to play your role properly. And those of you living abroad, if there's anything you can begin to do to support your home, no matter what country you're from, what state you're from, support in Plateau State, in Jos, in anywhere, just support the people with your medical profession. Okay, that's all we can take on the show. It's just the beginning of the week. See you tomorrow. Bye for now.